Hello everyone, my name is Anett Szabó and my PhD topic is male infertility, functionality and surgery. I work with Joel Koppa at the Andrology Center, and my vision is to educate patients regarding our findings concerning the risk factors associated with male infertility, and my mission would be a larger scale education of the population and the encouragement of prevention. We have 4 projects currently, and you'll see them in detail on the following slides. Our first project is a meta-analysis, and it's about the risk factors associated with sperm DNA fragmentation. We know that infertility rates are very high in developed countries. It ranges from 3.5 to 16.7%. And recently, sperm DNA fragmentation testing has become an evidence-based test in the evaluation of male infertility. And we do know that sperm DNA fragmentation affects male fertility. There are several risk factors associated with sperm DNA fragmentation, such as lifestyle, diet, obesity, age, and so on. Our aim is to investigate the effect and possibly the extent of known and suspected risk factors on sperm DNA fragmentation. Our clinical question is, what is the correlation between the different risk factors and sperm DNA fragmentation? And our hypothesis is that there is a correlation between the studied risk factors and sperm DNA fragmentation. And the clinical implication would obviously be to improve fertility parameters. We did a systematic search. We included in the search key the synonyms for sperm DNA fragmentation, and it yielded almost 27,000 articles. We did the full text selection and ended up with 263 articles, from which we're going to be doing the data extraction now. Our second topic is related to the first one, is the efficacy of interventions aiming to improve sperm DNA fragmentation. As we have discussed previously, there are several risk factors which are associated with sperm DNA fragmentation, thus we have to target each one differently. For example, we can advise the patient to exercise more, or stop smoking, or undergo a varicocectomy, and so on. Our aim is to investigate the interventions that could potentially decrease sperm DNA fragmentation. We have 2 PICOs, but it's just to include every intervention that we can possibly do to decrease sperm DNA fragmentation, since that is our outcome. And again, the hypothesis is that there is a decrease in sperm DNA fragmentation as a result of interventions that we do to improve it. And the clinical implication, again, is to improve the fertility. We have the same search key for this one as well, so the number of articles to begin with was the same, but we ended up with 107 articles from which we're going to be extracting the data. Our third topic is related to male infertility again. It's non-palpable testicular masses and their testis-sparing surgeries. We don't know the incidence of non-palpable testicular tumors. They're usually an accidental diagnosis when doing a fertility evaluation, and we find them via ultrasound. We know that most non-palpable tumors are benign, whereas the palpable ones are malignant. So for the non-palpable ones, it's recommended to do an organ-sparing surgery rather than to remove the entire testicle. And our hypothesis is that since most non-palpable testicular tumors are benign, the testes can be spared. And the clinical implication is that the testes and the full fertility capacity, as much as we can spare of it, it can be spared. We have 31 patients in this project, which is actually a quite high number according to literature, and we are in the phase of data collection. Our fourth project is the prediction of sperm retrieval in non-obstructive azoospermia via an artificial intelligence software. Azoospermia is defined as when there is no sperm in the ejaculate, and we can divide it into 2 subgroups, the obstructive type and the non-obstructive type. Here we're looking at the non-obstructive type only. There are several surgical approaches to extract sperm. One of them is a biopsy, the other one is a multifocal biopsy, and the third one, which is the best, is the testicular sperm extraction. Currently, we have no means of predicting whether by doing the testicular sperm extraction we would find any sperm or not. So we have this software which has been developed so that we can predict it before the surgery by using the endocrine parameters from the patient to find out whether it's worth doing the surgery or not. And our hypothesis is that success of sperm retrieval can be predicted via these preoperative parameters, and the clinical implication would be to avoid unnecessary surgeries. In this project, we have 91 participants. For the software, we are using a logit model and a neural network, which are the two things that combined give us a very high accuracy for the prediction of whether we do find sperm or not. It's currently 65 to 70% accurate, but once more patients are going to be coming, we're going to kind of reteach the software after every 5 to 10 patients to increase the accuracy of the prediction. So in a summary, we have 4 projects currently, and we plan on submitting the articles next year from all of them. And as a closing quote, I'd like to say that today is the first day of the rest of your life. Make it worthwhile to continue. Thank you for your attention.
Thank you for your presentation. During your first project, you mentioned that the age of a male can be a risk factor for DNA fragmentation. Do you already know that what is the age limit from where it's more pronounced, this risk?
Well, we say 40 is the age limit above which the sperm DNA fragmentation increases more rapidly. So it's advised to have children before the age of 40 for men.
Thank you.
Amazing work. A lot of work you have got on your hands. 107 articles eligible for a meta-analysis. That's a lot. What is your plan how to deal with that many studies? Are you going to do pooled analysis or lots of subgroups? Do you have any strategy yet about how to deal with that?
Well, as I was collecting the data, I was writing for every single article, the risk factors and the interventions included in it. So for risk factors, we have around 20 different ones, and we're going to even do subgroups from most of them, because even, for example, for varicocele, we have different grades for it, or for smoking, they don't always define the patient as smokers or non-smokers. They sometimes make categories, and for age even more, and there are even more categories. So we are going to have to do a lot of subgroups.
A lot of subgroups, including that many articles is a good idea, because this is going to be a big study which will be cited a lot. Now, my second question relates to your last project, which you showed us. It was the AI project, wasn't it?
Yes.
And parameters of interest, and I can see 1, 2, 3, 4, 5. The question is, are you going to feed your computer only these data, or are you going to feed a lot of clinical data, like patient is smoking, like the patient has got a BMI of whatever? So are you going to feed more data for your patients? Because what AI can do is AI can deal with a lot more data than statisticians.
Yes, thank you for the question. The way it was done, these are the parameters that are certainly of interest. A lot of other parameters have been included, and the way this was done was that the 91 patients, half of them were used to teach the software, and the other half was used to test the software, whether it could actually predict it correctly, whether there would be sperm or not. And there were many parameters included at the beginning, but it turned out that these are the ones of interest.
So basically, the computer suggested that it doesn't want any more data than just the hormones.
Yes, that these are the ones that we need exactly.
Well done.